Hey, good morning, and welcome to the UroPatient podcast. I'm your host, Vic Sinise. If you want to watch us live, you can catch us every Saturday at 10:30 a.m. on Facebook and on YouTube. Be sure to check us out. If you aren't if you're new to the show, be sure to check out our website at uropatient.com, where you can learn about the show and get more information on the show that way. Also, you can download any of our helpful handouts that we put out after every episode. So today we're going to be talking about bladder cancer, what you need to know, and what you don't know may be killing you. So first of all, what's to know about the bladder cancer is it is the second most common cancer that we find in the urinary tract system. So second most common cancer. 7% of these cancers are found in male and about 2% in females. As a matter of fact, the ratio of male to female is about 2.5 to 1. The average age of diagnosis is around 65 years of age, and about 85%, fortunately, are caught early enough that they're localized tumors. 15%, though, have already gone on to metastasize to other areas, which is the dangerous side. 80% of these cases are diagnosed after the age of 50. About 70% of these will present as superficial tumors, early stage. We'll talk more about what that is in a moment. Of those 70%, 10 to 20% will actually progress to muscle invasive lesions or much more dangerous lesions. So, what are the causes? Well, if all these slides that I've been showing with people smoking hasn't given you a good tip, it's smoking. Smoking is the number one cause of bladder cancer. Other things like chronic infections called cystitis, exposure to certain chemicals. Some chemotherapy agents have been known to do this. X-ray therapy as a treatment for cancer can sometimes affect that. And then idiopathic. Well, that's a fancy medical word for bad luck. Sometimes we don't know what the cause is, but it can just be bad luck. Smoking rates tend to be the highest among adults in their 20 to 40s. Been a little resurgence in smoking as of late. It's kind of started off as social and people get hooked on it. Individuals usually start at a younger age and just kind of continue the habit. It is the most common cause of bladder cancer, as I mentioned, and it can increase your risk of getting bladder cancer, by a total of 4. And it is dose related. So if you smoke 1 pack versus 2 packs or more, it's the higher the amount you get, the worse. Everybody kind of associates cigarette smoking with lung cancer, but it's actually a big cause of bladder cancer. I did mention chemical exposure, like certain dyes called aniline dyes and aromatic amines. These are often found in the hair dye industry. A lot of these have been removed, fortunately, from the products, but they back in years ago, we saw a lot of that. Some of the chemicals that were used to clean auto parts lead to bladder cancers. So some of these have been banned. Some of these are still need to be used with care. I mentioned earlier, X-ray therapy for cervical cancer can increase the risk of bladder cancer because of all that radiation that they're giving to the pelvis. Idiopathic, is it viral? Is it genetic? And we don't even know. So this is what your bladder looks like. Pretty much the male bladder, female are the same, except that a man has a prostate, which we see over here in that diagram. This is the most interesting part, though. It's the bladder is broken into linings, different linings. Most of these tumors that are superficials are in this very first layer, which is the one that's closest to the urine, and it's called the transitional cells. Why we give the name of most of those cancers transitional cell carcinoma. So these cells start to change because of the contact with these cancer-causing agents. If you think about why does cigarette smoke cause an increased risk in bladder cancer? Well, you smoke, it goes into your lungs filter the smoke, promptly puts it through the bloodstream. And what filters the bloodstream? Our kidneys. Our kidneys take over. They start filtering all those bad carcinogens out of the blood, and they put it into the urine, where it then drips down into the bladder and sits in the bladder for a long time until you urinate. So we're not emptying that one as quickly, so it gets more contact with the surfaces, especially this area here, and that's why those changes start to take place. Now the next layer is this area here called the lamina propria. This is kind of a nice barrier between the muscle wall, which is the area that we don't want to see the tumors get into, where they start invading the muscle that's when they can start to invade past that into the fat layers and beyond. So we have a nice system to kind of prevent tumors from going on. It's why a lot of these tumors are caught early on and can be treated and cured. This is another diagram what we stage the tumors. And again, this is what we want our tumors to look like, this thing up here, that just in that very outer layer. But again, over time, these things can progress and become more and more dangerous. As they start to progress, easy treatments aren't available anymore, and they can metastasize to other sites in your body and eventually could be a cause of your death. The presentation in this, for not as dramatic as what we see in this picture, of course, but is just painless blood in the urine. So hematuria can be gross, what we call gross, is not because it's yucky, but it's because it's visible to the eye. Patients, that's most typically what they come in, but sometimes you'll have a urine test and we'll pick up what we call microscopic blood, where we actually see in the microscope little blood cells, which could be the very first clue that there might be a bladder tumor. It can be intermittent, so things can clear up. That doesn't mean everything's cleared up. It means everything's okay. If you see blood in your urine, that's considered a medical cause to come in and see a urologist. Very important. Visit your family doctor. I'm sure they're going to refer you over. It can have some irritative symptoms, but usually not. That's not the most common, but similar to a bladder infection, some frequency, urgency. Dysuria means burning with the urine. But those are, like I said, not the most common presentations. What's the way we work up bladder cancer? Well, I call it the 4 C's: culture, cytology, CAT scan, and cysto. Let's talk a little bit about that. So cytology would be just getting a urine sample that's sent off to a special area where they stain it to look to see if there's any cancer cells in the urine. The thought is if the urine is shedding these cancer cells, then there's probably cancer somewhere. We do most commonly is called a triphasic CAT scan of the kidneys. This is what we call an upper tract workup. So even though the tumor may be in your bladder, it could be, as I was talking about, seeded from above, from a tumor up in the kidney or in the urine or anywhere in there. We need to be able to visualize that. CAT scan is the best. We call it triphasic because we look at 3 different phases. We take x-rays or CAT scan pictures before we put any dye in. And these are the kidneys up here that we're looking at. And this one here, there's our bladder right there. Then we look at what's called the vascular phase. We look at how the dye is being shown. Is it being uptake by the kidneys? So that's why they're starting to light up here. And then the final phase is delayed, where we actually can see the dye being converted to, or being shed through the urine. That's the little bit of dye right there, some dye right there coming down the ureter. You can actually track it all the way down when you look at these things and see if there's any tumors. And then here, of course, is our bladder again. So that's our part of our workup then. And then our last part is a cystoscopy. Often this is done almost always this is done in the office. But I talked about how cystoscopy is done in episode 5. So refer back to that one if you're not sure. Most of them are done with flexible cystoscopy. And this is what we're looking for. These are all bladder tumors. I always say it kind of looks like if you ever watched any of those shows of the ocean and those things growing off, those little leafy things coming off the bottom of the ocean. That's kind of what they look like. So all those are tumors. Real easy to spot. Trained urologists will pick it up like that. So how is it treated? We usually do what's called a TURBT. The first time it's done in the usually done in the OR as an outpatient. Go in with the rigid scope and remove that tumor. And I'll show you what that looks like. This is a tumor being scraped out with this cutting loop, sort of like the TUR of the prostate. So we can actually use that same type of cutting loop to get behind the tumor. And you can see there's the tumor there. That's this thing right up here. That's still tumor. He's going to get the loop behind it and get that cut out. And then we wash that out, take that sample and send it off to the pathologist, who can then determine a grading scale of how severe it is, whether this is a very early caught tumor or something worse. Hopefully you'll be lucky and this is an early caught tumor, and you just need to have simple surveillance, just kind of watch things. And our usual recommendation is to repeat that cystoscopy in the office as an outpatient every 3 months for the first year. Then we can there's no recurrence, move it up to every 6 months for the next year, and then yearly after that for the rest of your life. We'll do some cytologies in between, some upper tract studies for low-grade tumors every 3 to 4 years. And if it's a higher grade tumor, then we'll be looking at closer with a yearly upper tract. That was that CAT scan that I talked about. So hopefully yours will be one of those easy to cure and watch and surveil because they can come back. Hopefully that was a kind of a good introduction to what's involved in bladder cancer. If you're smoking, quit. What are you waiting for? Your life may depend on it. And sometimes, bad luck does happen. So again, we're going to talk a little bit further about bladder cancer in future episodes. And next week, I'm going to actually talk about when you have a cancer that's actually come back and recurred and they had to go back again and they want to prevent it from recurring or getting worse. There's a treatment called BCG. And we're going to talk about how that's given right in the office. Easy to do. We'll talk more about that. But in the meantime, we'll see you next week on the UroPatient podcast.